Thank you for having me. Hopkins makes me declare if I have any financial gain from giving this talk, and I don't. So some basic objectives for today's talk. I want to talk about sinus, postural headaches, vestibular headaches, talk about interventions that are appropriate for all of these things, and then hopefully give you guys some strategies on how to get rid of them once they've started and to stave them off in the future. Okay, so headaches, as everybody knows, it is pain in your head, neck, and face. And there's a little bit of mixed research about like what is the true pathophysiology of a headache. But the current thought is that it's a result of your muscles spasming around blood vessels that irritate your nerves that are all around it. And there are two main types of headaches. There's your primary headache and your secondary headache. Your primary is caused by something not medical related. It's not like a side effect of. So some examples are like your posture. We know that if you sit really horribly, you might get a headache later. If you eat a wonky food that you don't like, you can also get a headache from it. Like for some of us who love red wine, sometimes we can get headaches after your red wine. Or your sleep patterns can really affect your headache presentation. Your secondary headaches are usually symptoms of something else. So like, did you take a medicine that has a side effect of a headache, or did you smack your head into a wall and now you have a headache as a result? Is your blood pressure too high and that's why you have a headache? But fun fact, there's over 150 types of headache classifications. So yeah. And so I just lump it into primary and secondary. Which is why headaches are so fun, because you can go down the rabbit hole of like, where did my headache come from? And it's going to be different for every single person because there are just so many reasons we get a headache. So yeah, it's a fun time. So when I'm explaining this to my patients about like why we get headaches, where do they come from, I bring it back to high school biology. And for my patients, again, they're kids. They're like, oh yeah, I should have paid attention more that day. Or like, haven't gotten there yet. I'm like, all right, well, homeostasis in the nutshell, if you can think back to high school bio, is, as simply put, it's crucial survival for an organism. You get too hot, you start to sweat. You get too cold, you start to shiver. Your body has its set happy points that help you to survive. It's also kind of like your body's check engine light. If something starts to go wrong, you kind of get a headache. And it's a point for you to check in about what's going on in your system. And we know your body loves routines. It loves its stability, right? If you've missed your breakfast, you start getting a little hangry, and sometimes you can feel that blood sugar dip and you get a headache. You sleep too much, you sleep too little, you're off on your water. Like your body starts to say, hey, remember that thing you were supposed to do? Boom, there's your headache. There's a lot more too, but I love that homeostasis example if you're trying to figure out where things went wrong. And why do our headaches matter? And you're all here listening to me, so I think I don't have to convince you too much that they suck. But it's the third most common reason that people call out of work. And that impacts the whole socioeconomic status of at least the United States, and I'm sure other people as well. It's estimated that 60% of kids have experienced a headache by the time they're 14 years old. And this is actually thought to be underrepresented because kids can't really explain to you their pain very well. And headache symptoms are pretty vague. In some kids, their headache is not actually a headache at all. It's actually dizziness. So we're estimating that this is a lot higher now than reported. And when you get to be a good old adult, almost 100% of people have had a headache. And so it's now a very normalized thing, I think. People go, oh, I got a headache. Like, it's just part of life, headaches. And I think that's a really, really big problem. Headaches are not normal. You should not have headaches. They happen, but you need to treat them. They shouldn't be ignored. Because sometimes we just get the response from our doctors. You take your meds, you get over it, move on with your life. But that's not fixing the problem. That is treating a symptom. We usually have bigger issues that we have to address to stop them from coming back. And pain meds like Tylenol or ibuprofen don't always touch them either. So they're a big problem. And now let's flip the lens a little bit and zoom in on cystic fibrosis. We know that pain is present in 75% of kids with CF, and I'm sure, as you guys have experienced, almost everybody as you turn into that adulthood status. And what we found is headache is actually the most common reported pain symptom. Over 50% of people report it, followed then by pain in abdomen, chest, and back. And it's not just something that is there 1 or 2 days, it's a long-term and a chronic problem. More females are reporting this pain than men, and adults and children are actually reporting it with the same incidence. And we know that when you have more pain, you have more problems achieving your life goals. It's reported, and like your severity goes up, your participation goes down. And now that CF is transitioning from, just can we survive CF, it's now can we thrive with CF. Addressing pain is now one of the biggest challenges and something that we definitely want to continue to improve for everyone. And now we know we have all the modulators that are coming in and changing how people are experiencing their symptoms. And so we need to think about actually treating and preventing these headaches as people are now living longer, experiencing more pain for longer durations of time. Okay, yes, we know for sure when you have pain, it's also associated with anxiety, depression, lower quality of life, poor sleep. Where have we heard that before today? Associated with, decreasing in your physical activity, increased school absenteeism, work missing, and then if you feel like crap, you don't do your treatments. So yeah, it's going to impact so many different factors of your life, and that is going to tank lung function. So I don't need to harp on that point anymore, I don't think. So I am on a mission to help people treat their headaches. And headaches and CF, there's a lot of big ones out of the 150 that I could pull from. The biggest ones that we see, we have sinusitis, we have migraines, we have vestibular dysfunction, which I will talk about a lot more. We have tension headaches or cluster headaches. And we have other types of headaches, a cough, exertional, postural, and hypoxic. So lots of different factors that I'm going to talk about as we go through this talk to help you kind of figure out which one may be bugging you the most. Come on, button. Okay. Your history is crucial and sometimes the only data in which you can make a headache diagnosis. So it's important that we think about the type of pain that you're having, the severity, the location, which includes where did it start and where did it go, any exacerbating symptoms that point to migraine. So is it associated with an ear, your jaw, or anything around your sinuses? So when you talk to your team, it really helps to have thought about all these things before having this conversation, because our first step in treating that headache is to track it, find out if there's patterns. And a lot of times if the doctor says, well, tell me more about your headaches, you're like, well, it hurts. And so what I'm asking the kids, I'm like, well, does it start in your eyes? Does it start in your head and wrap around? Does it feel like someone's poking you with a hot poker? Does it happen all the time? So like starting to tease some of that out for yourself can be like, oh yeah, I do usually get it only after meals or first thing in the morning, or like it really comes in like the ram's horns and it wraps around and it digs. And all that points to different types of headaches that we can help. And otherwise you go to your doctor with nothing, you're like, yeah, it hurts. They're like, okay, keep a diary for me for like 30 days. And that is going to delay you getting treatment and finding solutions. So knowledge is one of the most empowering things in headache treatment, and starting to kind of take ownership of that. Not that you need more responsibilities, but lets you go to them with data. They like that. Okay, so now we're delving into some of these different headache types, and this is more of my ENT side, so I might kind of gloss a little bit, but I'll try my best. So sinusitis is inflammation in your sinuses. So anything kind of around the nose, cheeks, eyes, and even the front part of the head. And it needs to be incredibly specific. So when you have a headache and facial pain that's accompanied by usually really, really gross sputum, gross sinus drainage, like green snot, like really gross, that's pointing more towards sinusitis. But if you're just getting face pain, it's probably something else. So it could be a migraine, it could be a tension headache, and it could also be jaw problems that will cause that kind of head pain. Okay, so it's a little bit more on sinusitis. So sinusitis is usually correlated with an exacerbation. You get worse for periods of time, and then you get better, you get worse, you get better. And it's rhinosinusitis, so more in that nose area. When it is associated with an exacerbation, when you get treatment, it gets better and it stops. And a lot of times your provider will stick a scope up your nose to see if something is going on and if it's angry. This type of pain is more pressure-like, kind of dull, but it's often bilateral and around your eyes. And then you have really bad congestion and drainage that's associated with it. And yeah, you can tap on kind of around your cheekbones or in between your eyes. You can do like pretty aggressive taps. And if you're like, oh, that actually hurt, it's probably a sign that something is brewing in there. And these types of headache pains, they're not really associated with your common migraine triggers like light, sound, smell sensitivity. So if you have any of those, it's probably more migraine rather than sinusitis. This next slide is more about treatment for it and what an ENT would do to help diagnose you. So we're looking up somebody's nose and we see all this gross inflammation, green sputum, and I don't like looking at that. So I'm going to turn over the next slide, but they'll swab you and they'll help make an official diagnosis. You'll get some sinus sprays for it. They'll help you flush everything out, more steroids, because we want to help you get mucus out, which, in CF, that sounds like it's already a problem. So I bet y'all are real familiar with this guy. The next treatment that's actually kind of helpful, as Sergio was alluding to, is pressing on your sinuses, and we call that manual drainage. And what manual drainage does is it helps with giving you actual pressure to cause a release of the built-up mucus, bring in new blood flow, and help kind of push out anything that is there. So when we do manual drainage, and hopefully your PTs, well, actually, I don't know a lot of PTs that know how to do this. So you'll get to learn today, and that's exciting. So this is helpful for when you have a little bit of congestion in your head, when you feel like you have a lot of built-up mucus behind the eyes, ears, and nose, when you feel like you have that guy with that hot poker that's like stabbing you and it just doesn't go away, if you're having a hard time breathing through your nose. And what we're going to do for it is, when you can feel free to try this with me, and I'm new to the glasses club, so I keep bumping them. For our frontal sinus, we are going to gently place our thumbs. Well, if you're doing it to yourself, I like doing my thumbs this way because I feel like I can push a lot harder that way. We are going to essentially outline over our eyebrows. We're going to follow it all the way down to the corners of the eyes. And what you want is as firm as pressure as you can put. Ideally, your skin will turn bright red after you're done because you're pushing so hard. So you start with your thumbs right together, and you're going to push, and you're going to hold it. You want to do this for about 90 seconds if you can tolerate it. And you're going to slowly, like you want to be right on top of those eyebrows, but not on them, so right above them. And you're going to slowly pull those fingertips apart. Hopefully the camera can come in and see this here too. It's going to feel worse before it starts to feel better. There is a nerve that lives right under your thumbs, kind of at the peak or the arch of the eyebrow, and it gets really mad when you push on it, but it feels so good when you're done. So you keep hold of it, and you try to hold it for that 90 seconds. You suffer through a little bit of the pain, and when you get to the very edge of your eyes, you're just going to let your thumbs roll off, and it should feel like an instant release of the pressure. And if you did it right, I call it to the kids, I say, it feels like a waterfall, just like a whoosh. And that can be done as many times as you want. There's no too much for it. And it can help keep a headache that's brewing at bay. And some people need to cough, they need to sneeze, they might need to blow their nose after doing this because you can actually start feeling some of the built up mucus leaving. All right, our next one is for the ethmoid sinus, and that lives between your eyes. So that hot poker-like headache that is building, or you feel like you're staring at your computer too long and you're getting that just like naggy, like ick, you know, that's just deep in there. This one is helpful for the next headache. You do want to have clean hands for this one because you are going to be near your eyeballs. I'm going to take my thumbs and I'm going to put them as far back in my eye socket, as close to my nose as I can. And you're going to feel a little bit of like a small little bump, kind of like a grain of rice. That's your tear duct. You don't want to push on that. So you want to be close, like closer to the world, less to your face than your tear duct. All right, you're going to try to push your thumbs together like they're magnets attracting each other. This can be very tender. This can be very, very tender. Once you're pushing on that, you do want to hold it again for that 90 seconds to a minute and a half, well, to 120 seconds. And then you're slowly going to let your thumbs leave and go back to the world while you're still trying to maintain as firm as pressure as possible. And as soon as you leave firm bone, you're going to feel it, and it's going to change into like a squishy little nose bridge. Once you get to the squishy part, you're done. Again, it's going to be intense, but when you're having that sharp, hot poker pain, this feels nice for most people. You'll see me at my desk all of the time, just like head on, hands here, just holding, because that helps me stave off a migraine if I've been at my computer for too long. Okay, and the last one is your maxillary sinus. So this is starting at the nose and going through your cheekbones. So we're going to start, like if you feel on your nose, you have a bony part and you have a squishy part. This one you want to start on the bony part of the bridge of your nose. We're going to use 2 fingers, and we're going to trace from that bony bridge of the nose over top of your cheekbones all the way to your ears almost. And again, you want really nice, firm pressure. You got it? You want firm, firm pressure. About 90 seconds here again. And if you're doing it right, you're going to get a tension point kind of in between your nose bridge and your cheeks. You know those strips you might see runners with that help open up their nasal passages? We're essentially trying to do that with our fingers right now with how much tension we have on. And then you should be able to take a really good breath through your nose and have it clear and not be so bogged down. And then once you get to the point where you're at like the corners of the cheekbones to the eyes, you can let your hands kind of come off. And so that helps to drain that sinus that's right on underneath those eyes. I don't like that one as much, but that's not my problem sinus. Yeah, but when you're getting some seasonal allergies, when you're feeling super congested, when maybe the rhinosinus is flaring up a little bit, this is a good one just to introduce. This is all preventative treatment. Like, it is a good one just to throw in there if you're like, I feel something brewing, you can't do it enough. All right, let's get into a little bit more migraine-y. So we're leaving sinus and going into migraines. It's a very, very common condition in the general population. It comes in many different flavors, if you will. There's a bias that more females have migraines than males, but that doesn't mean it doesn't happen. They occur throughout the lifetime. I see a lot of kids in my clinic for migraine as young as 3 years old. So it does happen in kids as well. They do kind of peak incidence at 30 to 50 years old, and they're characterized by really nasty headaches that last anywhere from 4 hours to 72 hours. They're often the headaches that hit you on one side of the head, but also can be bilateral. They have a throbbing kind of pulse-like quality where it's just like that, like pounding. And migraines have triggers. And when you talk to somebody, they're like, yeah, I know exactly what triggers my migraines. At least most people do. If they have a good team, you've figured out what your migraine triggers are. They can include motion. They can include sights, sounds, smells. And you can notice that you're going to get motion sickness, fatigue. Some people see it around their hormone shifts. So any time of like menstrual cycles, or if you've switched a medicine that alters some of your hormones. Stress is also a pretty big trigger for some people with migraines. We can blame it on the weather as well because it changes in barometric pressure. And then sometimes diets. There are specific foods that can be more irritating to other people. It just really highlights why headaches are a problem, because you can be hunting down the rabbit hole of like, what was it? Was it this? Was it something else? Was it my medicine? Is it something that I ate? And it can literally be a factor of everything. So that sucks. I'm a big proponent of whatever you have figured out that helps your body calm down and kick it. That's a useful tool then. And who am I to say boo to it unless it's actually causing you physical harm? Okay. Yeah, migraines are terrible. They can also produce a little bit more what we call the autonomic symptoms. So crying, congestion, they can present with a little bit more issues around the face, some hot flashes sometimes. And you can also get confused if you have migraine or you have sinusitis, because you can get sinus symptoms with migraines. So this is also why people are like, I don't know, go see a neurologist. They'll sort you out. what they do. So basically, if you have migraines and you're confused, is it sinusitis, is it migraine? If you're having them recurrent, it's not associated with any green snot, you probably have a migraine condition, versus if you have really gross snot, fever, headache, like actual signs of something wrong, most likely sinusitis, and you want to get that treated as well. So in my opinion, when you're working on getting treatment for a migraine, you should be working with a neurologist, because there's different triggers that can happen to cause them. And there are some stuff that we do behavior-wise, dietary-wise. I'm sure everyone's talked about sleep hygiene until the cows come home. Sleep is a problem with anybody with a chronic condition. And I know you guys have been told to exercise, again, until we're blue in the face as a PT. But your neurologist might say, try some of these supplements that can be helpful. And again, I'm not licensed to talk about some of these things. So work with your team about, is this an appropriate thing for you to try? Because again, it varies for everybody, but the B vitamins, magnesium, CoQ10, melatonin, and then there's some other ones like Butterbur and Feverview that have been found to be a little bit helpful, and from a supplementary standpoint. Then there are your abortive meds. That's, I have a migraine, I need to kill it. There's the preventative meds. That's, obviously stopping that before it happens. And then a good neurologist will also refer you to physical therapy. And then an even better neurologist is also going to say, let's work together with our psychology team to help treat any coexisting issues with stress, anxiety, depression, and any struggles with mental health that can make migraines even more debilitating than they already are. So we're very much a team approach for working with migraines. And in my opinion, for physical therapy, I work with people again all the time when we have these episodes. But if you're actively in a migraine, I can't really do anything to stop it. Train's left the station. So I usually tell my patients, if you come in with a migraine, I'm going to send you home. Like, go sleep it off. Go do something else. I'm not going to be able to help you tolerate any of your triggers better. So I'm going to say, you have to control your migraine first. So let's work with your medicines. Let's look about finding your triggers. And again, the most common is light, sound, smells. So there are earplugs that you can wear if you're noticing you're more sensitive. So like the loop earplugs, I don't know if anybody's seen those. They are sound filtering. They take the edge off by like 10 to 15 decibels, and it doesn't look like you're wearing anything at all. And you can continue to go on your life, and it takes the annoyance down. So I love those. They are an in-ear type of earplug. And they have different models that can be more filtering or less filtering depending on how sensitive you are. In this picture on the slide, I am wearing my Elton John glasses. These are rose tinted sunglasses, and they are FDA approved to help reduce headaches, dizziness, nausea from light. So if you're someone who is very light sensitive when you are having headache pain, these help incredibly to take the edge off. There are specific brands you can buy if you want to spend a fortune, or you can go on Amazon and buy my $32 pair, which I'm always say, try it before you invest in anything fancy. Companies do exist for prescription ones, but again, if you want to pay that much. So a little bit more about PT, because personal bias, PT here, right? I'm going to help work with you on removing the triggers that you see commonly. So if we find that your neck has a lot of issues that are causing headaches, I'll help you work through some of those so that those muscles are not aggravating those nerves. I'll help you work on calming down your autonomic nervous system, so that rest, digest versus flight or flight symptoms. We work through some of that with, like, diaphragmatic breathing and maybe some more mindfulness techniques, but also ways to help you feel revved up without feeling stressed. And then if you are someone who's motion sick when you have headaches, we work on motion tolerance. If you're having problems with your balance, we work on your balance. If you're having problems with your eyes, we work on your eyes. So therapy is helpful in helping you find your triggers, but also tolerating them better, so that you can handle more of those things in your day without dumping into a migraine episode. All right, so headache hygiene, restoring homeostasis and removing your triggers, aka prevention of a further headache or migraine. So some of the biggest ones, we're going to talk sleep, exercise, fuel, hydration, and I have like a ton of slides about more things in detail. So, goodness, so much stuff to talk about. Sleep. And I know sleep is a button topic here because so many things that you guys have to live through disrupt your sleep. Hormone changes, hydration changes, insomnia problems, waking up to do treatments, or just like feeling like crap because you're waking up and coughing. And I'm sure there's a whole lot more that I will never get to know about. Like there's lots of reasons that we know that the body wants this predictable sleep schedule. And so what best practice is for me to say is to try to keep your sleep and your wake really consistent, even if it's a weekend, even if you don't have school or work, because the body is craving predictability. It's saying, I am setting my natural rhythm to go to sleep. That means all of my hormones, my appetite, all of those things are set to start working at a specific time, right? And so when you wake up, your body's like, where's my hit of caffeine? When am I going to get to the bathroom? Like all this stuff has to happen because I'm used to it and I'm predicting that it's going to. So I'm getting your blood sugar ready to handle that breakfast that you promised me. And so you have like a 30-minute window before the body starts to really freak out and get off its rhythm. So my teenagers all roll my eyes at me when I say, like, even on weekends, please wake up 30 minutes of your normal school time. Sorry. But you will feel better once you're on that consistent schedule. And a goal for 7 to 9 hours of sleep, but realistically, if you find a set that works for you, you want to stay consistent with it. Exercise, again, daily, predictable if you can, 30 minutes of whatever feels good for your body. And again, if you keep it consistent, you're going to get that hit of endorphins. Your body's like, yes, thank you for giving that to me. And again, setting up consistency. Fuel, so food. We want to work with our nutrition team about ways to eat predictably. Large meals can't often be an option if you're struggling with, pancreatitis or diabetes and you need to manage your enzymes and your insulin. So working with the team to help prevent headaches if it could be food related. So that's that my empty stomach, I'm hangry, where's that hit of sugar you promised me? It can be catastrophic if you're not giving it that expected meal. And then we're also thinking about nutrients in the food that we're snacking on. If we're getting super large sugar spikes, was our body ready to process that? And I call it the sugar dragon. Are you feeding this monster that wants all the sugar? And if you don't give it the sugar, are you paying for it later? Yeah. Yep. We can blame our caveman status for the sugar dragon because when we were evolutionary growing up, if you will, if there was a really good sugary meal, the body's going to eat that entire thing and then ask for more. Like, I don't know when I'm going to get that again. And we as humans have not evolved out of that. We always want more sugar. So, hydration. This one, we're not just dehydrated. The goal, that stuck with me at the talk earlier about menopause, because it's not just getting in water. We try to get half our body weight in water. That's what's found to be effective for staying hydrated. But there's a whole lot more to that. You have to add an extra if it's hot, if you're at altitude, if you're exercising, if you like caffeine, you have to have some water to balance out how much you're peeing. And water is definitely not enough, especially with CF. And how many times do they say drink your Gatorade, drink your electrolytes, get all that stuff to help you get more salt in your body. And I have a couple of my favorite electrolytes listed here, and I'm happy to send this out later too. And a lot of people just end up chugging their electrolytes because they hate how it tastes. They're just like, I know I have to drink this and I'm going to be on with my day. And when you chug, your body says, oh, I have so much, I don't need it. And you pee it all out, and it does not help you one bit or the other. So what I recommend people do is we take water, we take electrolytes, we take water, we take electrolytes. So you're getting a constant refreshment of whatever you're putting in your body. And a complication on that is, oh, come on, clicker. We know salt loss, electrolyte loss is a core feature of cystic fibrosis. It's like what we test for, and it's designed to do. So you may need a whole lot more salt than the average Joe does, which again, you already know. When we have such excessive salt loss, we trigger hormone activation. Your body tries to save the salt that you have, and it constricts all of the major blood vessels. And when we constrict the blood vessels, we irritate the smooth muscle around the nerves, which cause headaches. So you're stuck in this constant dehydration status, even though you're drinking water, because you're peeing out your salts because nothing's staying in, and we're getting constriction after constriction. So you need electrolytes. It's proven to improve infant growth, reduces your dehydration, improves your airway physiology. But we have no studies that say how much is too much and whatnot. Okay, so vestibular dysfunction. So like I said earlier, it's your balance system, it's your motion processing center, and headaches and dizziness often happen at the same time. And with patients with CF, you're both at risk for headache from everything we've already talked about, and also vestibular dysfunction with aminoglycosides and all the antibiotics that can have a really negative effect on the inner ear. So both do need to be treated. Your headache stuff has to get treated, and then the vestibular stuff have to be treated. And this is, it's happening both in kids and adults. So you may get headache as your only symptom. You may get dizziness. Vestibular migraine is a diagnostic thing. It occurs more in kids than it does adults, thankfully. And it's a hard diagnosis to get. It's kind of that diagnosis of exclusion, but that's if your headaches are more, I'm feeling off balance, I'm feeling dizzy, I'm feeling more brain foggy, I have a lot of anxiety about movement, I just feel kind of off. That is more the vestibular migraine type of condition, rather than I'm having a ton of pain. A lot of people don't actually have pain with a vestibular migraine episode. They just can't do things because they're so nauseous and dizzy and they can't tolerate moving. And the aminoglycosides, I don't know if everybody's heard about this. I think you have, because you have CF and you've talked about this. But it is an irreversible hair cell death. And your hair cells process, again, movement, it registers, you've changed your head position. If there's challenges and changes in that, you may experience vertigo a little bit more easily than anybody else. And you benefit from seeing me as a physical therapist to help you get through that. Because you can get dizziness, unsteadiness. Oscillopsia is a fancy term for your eyes are shaking when you walk. So imagine Friday the 13th all of the time. Just that as your vision. So you know you have it. So it is important when you're on IV antibiotics to check in with your balance to see if you're getting headaches, if you're feeling more off balance, or just like iffy. You should immediately talk with the people you're working with so that that doesn't go bad. I talked a little bit about the vestibular headaches. Motion is usually what triggers that iffy headaches. And to treat that, see a vestibular physical therapist, so another selfish self-plug, where we work on being okay with the movement. We help train and fix some of those problems that can be caused so that you're not falling over when you're walking and turning your head, that you're not getting car sick or motion sick. And you can do everything you want. Tension type headaches, they happen because of our postures usually. I'm sure if you slumped or slept funny, you've held your body in a weird position, you start noticing that your body aches, and then you may get a headache as a result. It's usually this pressing kind of like clenchy type of pain, not like the throbbies that are more of the migraine headaches. And this doesn't really happen if you're actively like racing your heart. So if you're not exercising, this isn't a type of headache that you get. You don't usually get nauseous or you vomit from this. You can get some light and sound sensitivity, but usually not. And your muscles usually hurt while this is happening. And some of the postures that we see with CF, I'm sure some of these look a little familiar. A lot of schlumpy, a lot of neck in this awkward position. And then when you are coughing, when you are trying to expand your lungs, you actually overactivate all the neck muscles that can cause tension and trigger headaches. So like your neck muscle here, this is your sternocleidomastoid. You can find it by turning your head and bending forward. And you see this really big bandy muscle that pops up. That's your naughty sternocleidomastoid. And if you wanted to look for any of those spots that are a little aggravating, come on, computer. I'll go through it in a couple slides, sorry. There's more. We can push on it. If we push hard enough, it'll let go, and it can reduce some of those tension points. So this is called myofascial release or trigger point therapy. The goal is to push on it so hard that it lets go. That is not a comfortable sensation again. It is what it is. But this is actually found to reduce and immediately reduce headache pain from your muscles. So again, triggers, you're going to push on something that hurts. It's not going to be comfy until you're done doing it. I describe people like, what happens if you hold your breath? Eventually you pass out and your body goes numb and you're like, yay, I'm a floppy noodle. we're trying to do that for the naughty muscle. Okay, we're trying to push on it so hard it lets go. And everybody has trigger points throughout their body, but they're not all causing you problems. So if you find something and you push on it and it hurts, sure, that's normal. But if it's causing you a headache, that's something to push on. So you can go on treasure hunts and find it. So the sternocleidomastoid, it has these points all throughout your neck that can refer to headache in the back, but also right around the eyebrow and kind of wraps forwards. So what you do is you kind of use your thumb again and you're just kind of trying to grab onto it like you're pinching a key, like, you know, old door keys when we still had them. And if you find something you're like, oh my gosh, that's causing a headache, you get to stay on it and you hold it. Again, 90 to 120 seconds, and it should let go, and you should feel better. I'm trying to go fast so that I have enough time. Your levator scap. This is your shoulder shrugger. It's also something that you use when you are breathing and coughing really hard. So this can get very overused when you're having an episode and a flare. I describe it as your Vulcan death grip. So you're kind of grabbing onto those guys up here at your shoulders and you're pinching it. That's why it hurts so bad for all those people that, you know, get this. And you're like, ah, stop. But if it feels like your headache, and I have it right now, it's coming right here, you stay on it until it lets go. And then once you do let it go, pressure goes away and you feel better. Your suboccipitals, these guys are in the very back of your head. They are right at the base of the skull. And these ones, for anybody that slumps forward, these guys get irritated. And so stick your thumbs back there and push hard. If it feels like a headache, you found a treasure chest and stay there. But if it just hurts, it's not worth pushing. So again, 90 seconds. Okay, headaches attributed to hypoxia, which you'd get after having an episode if your SpO2 is dropping really, really low, or if you're at a high altitude. You have to be having O2 loss before you get these headaches. It can also happen if you're coughing because you're straining and it increases the pressure in your brain, and that can trigger very sharp, stabby pain for just a couple seconds. But again, if your brain's experienced it enough, it's going to have a lingering effect, like, hey, knock it off, you made me mad. So usually you take some meds to help with that one. And then there are some other like signs of more dangerous stuff, but this is very, very uncommon for people. So I don't want to spend a ton of time talking about stuff that's not likely going to happen. So I'm going to slip through that. But yeah, you can cough yourself into a headache. The biggest red flags for like, when is this more than just a headache or a migraine? When do I need to get help? Like emergency room help. If your headache is not going away no matter what you're doing, and this is something that has never happened to you before, it's worth going to get that checked out. If it's waking you up from sleep, it's worth getting checked out. And if it's all of a sudden feels like you got hit in the head with a baseball bat, you should go get that checked out. If you're having a headache and you have a really high fever, that is worth getting checked out. And then if you're having changes with your vision, your face is all puffed up, you should get checked out. And then if you bend forward and you cough and your head hurts, you should go checked out. And Valsalva, in case you don't know what that means, that's your bearing down. It's your holding your breath and straining. If you have a headache with that or head pain, go get checked out. So that's my little red flags. And then the whole team should help you get support. See an ENT, a neurologist, psychologist, me as a PT if you're in Baltimore. And then CAM stands for Complementary Alternative Medicine. So think yoga, acupuncture, all of those really good holistic type things are found to be very helpful for headaches. And a good provider will help you find a good one. So basically, in summary, sorry for the overtime. Headaches can come from a whole bunch of different causes, and CF kind of gives you everything, because everything can be causing you problems, from your medicine to your lack of sleep, and yeah. But knowing why and trying to tease out what flavor is causing my headache is a really big factor to it. And again, just because they're common does not make it normal, and they should not be ignored. And PT is your friend, and then use your tools to help remove your triggers so that you don't have them as often.